Thank you. I want to thank you all, first of all, for being here tonight. At the end of tonight, you will understand a little bit more about what chiropractic really is. What kind of a problem do I really have? Is it canal stenosis? Is it a disc problem? Is it arthritis? Is it a pulled muscle? By the time you leave here tonight, you'll understand all of that. Okay, so you'll come away knowing a lot about chiropractic, really a lot about anatomy, and a lot about your spine. Okay, so thanks for being here. Let's get started. What's the number one reason anybody goes to any doctor? The number one reason is pain. Okay? It's a four-letter word. It hurts. It will get your attention. It will cause people to do tremendous things just to get away from pain. So I see some patients who come in, they've had multiple surgeries. They've been told that, they're never going to be able to get out of pain. I've had some patients even think about committing suicide because this is relentless. This can actually be severe. This can change your life. And on some patients, it's there one day, the next day it's gone. Next day it's on the right, and then it's on the left, and it goes up, and it goes down. And so what in the world is this thing called pain? Well, it can destroy your life, but really we can classify it really as being a symptom. Now, it's the number one symptom, but there's other symptoms besides pain. Some patients come and see us for sinus trouble, stuffed up nose, congestion. Some patients come and see us for dizziness, for irregular heartbeats, for hearing impaired or ear infections with kids, or digestive issues which may not be painful. They may be, but it could be, constipation. May not be that painful, but it can destroy your life. Or it can be diarrhea. All sorts of different things. Ringing in the ears. A constant ringing in the ears that just doesn't go away. Now, it may not be painful, but it can actually interfere with your day. If you're dizzy, you're not going to be up climbing on a ladder. You may not even be able to drive your car if you're dizzy. All right? So many different kinds of symptoms. Pain is number one. And the purpose behind symptoms in general, especially pain, is your body's trying to tell you something is wrong. Hello, stop. Time out. It's trying to stop you. So it's a sign or a signal telling you something is wrong. Your body can't email you, okay? It can't text you. It can't Twitter you. It's not going to put something on Facebook. So how is it going to be able to tell you? It gives you pain. So there's a purpose behind this, okay? It's a system that our body uses to protect ourselves. Everybody's got to go someplace. We've got to do something. Our lives are so busy. But your body's going to tell you, hey, stop. Take a relax. Okay, you don't do that today. Because if you do that, you're going to go ahead and hurt us. So I'm going to make sure you go ahead and lay down. I'm going to make sure you take it slow today. Because if you keep on doing this, you're going to hurt us. So it's a self-protective mechanism. So thank God we have it. But the first thing that we want when we have pain or symptoms is, what? Relief. And I ask our patients sometimes, how do you spell relief? And for our older patients, of course, R-O-L-A-I-D-S. And I'll come back to that here in just a second. So, relief. Everybody wants relief right away. That's why you're here. That's why you've come to my office, to get relief. And normally, how do we get relief? We do what? We take a pill. We take a Rolaids. If we have a headache, we take an aspirin. If we have an upset stomach, we take some kind of a stomach antacid, something, or a sinus thing to clear up our sinuses. And in chiropractic, we understand people take medication. Sometimes they may have to take medication. If your blood pressure is up here, you better take something to bring it down. If your blood sugar is here, you better take something to bring it down. But you have to realize the drug is not the cure. The symptoms may go away and you may get relief, which sometimes is fine, or in most cases obviously it's fine. But when it comes to a spine, taking a pill to get relief, you're not getting at the real root of the problem. So insulin, you have to take it for your diabetes. Blood pressure medication, you have to take it for your blood pressure problem. But it's not fixing the problem. In chiropractic, especially, we're trying to get to the root of the problem. The main issue, ladies and gentlemen, is there's an underlying condition. This is the problem, not this. Even though these are what we pay attention to, and this is what the commercials inundate us with all day long on TV, this is what we have to deal with. This is what we have to fix. This is what we have to discuss now. So yes, everybody comes in trying to get to relief, but we have to deal with this. This is the only way a patient's really going to get to relief. Your body's trying to tell you something is wrong because something is wrong with this. Okay? So it's a very simple concept. I could have summarized this whole thing and said, just get to the root of the problem. And I would have saved a 5-minute discussion. But this is the number one key our patient's conversation usually comes back to. Patient talks here. I talk here. Patient tells me about this. I try to relate it to this. Okay, so my job is to try to teach you why these symptoms are changing. I'll ask you when you come in, how are your symptoms? And we write that down, mainly for insurance purposes, and to let you know I'm dealing with this. But this is what I'm going to try to teach you about, how to manage the condition, the root of your problem that's causing all your symptoms. Okay? So, let's talk about this condition. What in the world does a chiropractor take care of? If you ask a person, any person who sees a chiropractor, what is the actual diagnosis? What does a chiropractor actually diagnose and correct and manage? What is the actual term? And people will say, well, geez, I don't know. It's a back problem. It's pain. It's a spasm. It's arthritis. And they come up with all these different terms because that's what we're known as, really, as back doctors. But the term I'm really looking for is called subluxation. So subluxation. It's a term that we've used now for, well, quite a few years, since the beginning of chiropractic. Subluxation. Sub means less than. Lux means dislocation. Ation means a condition. So a condition describing less than a dislocation is really what that is. Now this will be about 80% of our conversation tonight. I'll break this down and we'll go through the biomechanical and neurological aspects of this. All right. Let's show you a spine to show you basically what a subluxation looks like.